Welcome back to Mountain Connections. I'm your host, Kimberly Perot, and as we are all aware, February is Heart Health Awareness Month. Christine actually had a wonderful conversation, a very educational conversation, about how to recognize undiagnosed heart conditions. We'll have a quick listen right here.
Approximately between 1 in 200 and 1 in 500 people in the general population live with a particular heart disease called Hypertrophic Cardiomyopathy. And despite it being the most common inherited heart condition, about 85% of people don't even know they have it. Hypertrophic cardiomyopathy, or HCM, can be a debilitating condition that can reduce physical function and have a major effect on overall well-being. Here to talk about HCM and why it's important to talk to your doctor if you believe you may be experiencing symptoms are Lisa Salberg, founder and CEO of the Hypertrophic Cardiomyopathy Association, and Dr. Matthew Martinez, a board-certified cardiologist. Thank you, both of you, for being here today.
Thanks for having us.
Thank you.
Lisa, tell us about your HCM diagnosis and how the disease has impacted your life and that of your family.
Well, my diagnosis came back in 1980 at the age of 12 in a school physical where a murmur was detected. That sent me off to a cardiologist where we discussed my family health history, which included the sudden cardiac arrest of my grandfather at 43 and a stroke-related death of my aunt at about 50. My uncle and my sister were already diagnosed by that point as well, so it was pretty clear as to where that murmur had come from. We looked pretty normal, we acted pretty normal, but I did have symptoms. I would get short of breath walking to my classes, I would get chest pain, I would pass out occasionally, and I learned to live with these symptoms throughout my entire life. Unfortunately, in 1990, my uncle had a cardiac arrest and passed away in his late 40s. And then in 1995, my sister died suddenly and unexpectedly from mismanaged HCM at the age of 36. So that led to the HCMA's formation. But then our family history and our family story continued, including the diagnosis of my niece, nephew, daughter, father, and other family members. So it's kind of everywhere in my family, which is why the work of the HCMA is so important.
That's really difficult. I appreciate you for sharing that. Dr. Martinez, tell us more about HCM, its common symptoms, and why the disease so often goes undiagnosed.
So hypertrophic cardiomyopathy, or HCM, is a common condition, and it often runs in families just like you heard about in Lisa. And it's an abnormal thickening of the heart muscle that can lead to difficulty with the heart pumping blood throughout the body. Now, although many folks have no symptoms, others may have an abnormal murmur like you heard in Lisa, but others have symptoms: chest pressure, breathlessness, dizziness, and they may even pass out related to the condition of hypertrophic cardiomyopathy. But those are common symptoms, and they overlap with other common conditions that also cause those same types of symptoms. So that's the challenge when making a diagnosis of hypertrophic cardiomyopathy. To many, it sounds like other conditions. And as a result, we know about 85% of those with hypertrophic cardiomyopathy go misdiagnosed or undiagnosed. So making the diagnosis, that's what's really key.
Lisa, tell us about what the Hypertrophic Cardiomyopathy Association does and why it is so important to bring attention to HCM.
Well, first of all, most of our patients and families that we work with have a very complicated diagnosis and are living in little bubbles all around America and all around the world. So they think that they're alone, and we need to tell them that they're not alone, that we're there to support them. Additionally, we provide educational resources to both medical professionals and patients through our HCM Academy for medical professionals, our Big Hearted Warrior tours, our podcasting. We provide content and education and support. We have discussion groups for patients. We have online forums that they can talk to each other. We have HCMA recognized centers of excellence. Currently, there are 43 of them in the United States, and we're taking it worldwide soon. So there's lots of resources available, and you can find them at forhcm.org, or you can find information about HCM as a disease at coulditbehcm.com. Both of these are great resources for people to look into, and they can learn about all of the things we're doing at the HCMA, including legislative initiatives to help in the screening process so we can find the undiagnosed.
Dr. Martinez, what should people do if they or a family member are experiencing any symptoms?
So be your own advocate. Patients should take some ownership if they have symptoms and talk to your healthcare provider, find an HCM expert, because it's education and awareness that's the most important part of this story. And for that reason, we're partnering with HCMA and Bristol Myers Squibb to bring education and awareness about this common condition of hypertrophic cardiomyopathy. I want to say thank you for bringing this to the attention of your viewers. It's a really important diagnosis that has to be made.
And Lisa, what is your personal advice for anyone recently diagnosed or living with HCM, and where should we get more information?
So if you're recently diagnosed, don't panic. We've got your back. We're here for you. If you're on the HCM journey and not sure if you're getting the best care possible and that you're at the cutting edge of HCM knowledge, please get to a center of excellence for evaluation. You can find them on our website at forhcm.org and get engaged with your community. You can also visit coulditbehcm.com. We have a very active community here. Come on in. The water's fine. Don't be scared. And thank you so much for bringing attention to HCM.
Well, thank you, both of you, Lisa and Dr. Martinez, for joining us today. Really appreciate this important information about HCM and helping people not feel so alone. Thanks for your time.
Appreciate it.